Hi, this is State Senator Tom George. Welcome to my program, Current Events. And today I have with me two special guests. I have Bob Swanson, who is the director of the Immunization program at the Michigan Department of Community Health, and Dr. Greg Holzman, who is the state's medical officer. And I've asked these two gentlemen to come on today so we can talk about vaccinations, because August is Immunization Awareness Month. Welcome to my program.
Thank you.
Thanks for having us.
Bob, maybe we should just start with you. Tell me a little bit about your duties as the immunization director, and what should we know with Immunization Month coming up?
Duties are fairly broad. We, in Michigan Department of Community Health, we purchase vaccines, we distribute vaccines, about $105 million worth, mostly federally funded, that are distributed to eligible kids every year, primarily children that we vaccinate. So we do a lot with the distribution of vaccines, and we manage also a lot of educational tools that we make available to physician offices, to parents, to local health departments, as well as manage a registry to keep track of kids' immunizations so that we don't have to continually track them down. We've got them in one central database so that schools can access them, and also physician offices, so they can make better judgment on which vaccines are needed.
And Dr. Holzman, you have a background in public health, and you've been the chief medical officer here now for several months with the state. And so your duties would be broader than just the vaccination program. Maybe you can just give me an overview of your duties, and then we'll focus in on vaccinations.
Sure. I'm kind of the advisor. According to the Public Health Code, if the director of the Michigan Department of Community Health is not a physician, who is Janet Olszewski, and she is not, then they must have a chief medical executive, and that's where my position comes in. And so I act as an advisor to Janet on medical issues, but I'm also very involved within the administration of public health with Jean Chabot in that area, and deal with all the areas in public health, whether it be from immunizations to some of our programs in tobacco or in other areas.
And your background was in family medicine?
I've done 2 residencies. I first did a residency in family medicine, and I'm board certified in that, and then worked on the Indian reservation, as we talked about beforehand, and then decided to go back and do a second residency in preventive medicine, where I got my master's in public health and got some public health training.
With Immunization Awareness Month coming up, what should we know about? What's important for the public to know when it comes to immunizations?
You know, the one thing I think that's really interesting about immunization, sometimes when we don't see things after a while, we forget about what a Scrooge they were. And, you know, if we look back at the turn of last century, when the average lifespan was 47 years at the turn of last century, 1900, and now we're close to 77, which is a little different with different groups. But a lot of that has to do with public health, and immunizations is one area that has made a big difference. And you think about the number of deaths and morbidity that happen from things like smallpox, not even around anymore, completely eradicated. Polio, which we haven't had a live polio virus, we've had some secondary to the oral vaccination since 1979. And then other ones that have had huge decreases, like Hib vaccine, which is the Haemophilus influenza type B, which probably you remember from your medical school days, and even in my medical school days, we saw kids with, meningitis from that. It was a serious disease, and now luckily that's a rare occurrence because of that vaccination. A lot more coming on the front these days. They're popping up with all sorts of different vaccinations and new ones coming down the pipeline that has made a big difference.
So vaccinations are an example of medical progress and medical technology that's taken place in our own lifetimes. And Bob, you help with the hands-on overseeing of the program, the delivery of the vaccines. These are mostly focused around school-age children.
Actually, vaccination has now become a birth-to-death activity, which I think is something that's missed a lot. We focus a lot of activities on the childhood vaccines. And we've actually now we're beginning to focus more on the adults. Every adult should be getting a flu vaccine every year. They should be getting pneumococcal vaccine. They should make sure that they have their tetanus, diphtheria, and pertussis vaccine, a newly licensed pertussis vaccine for adults. We need to try to get those into adults as well. One of the things that we're trying to do with the month of August, though, is make sure that kids get back so that we can get them prepared to go into school. When you think about school age, it's required for kindergartners to be up to date with their immunizations. Schools are going to look at that to see which vaccines they have or haven't received, and if we can get some of that completed before they enter school, it saves a lot of people a lot of time.
And the schools are required to check for certain grade levels?
Schools are required to check for any kindergartners and any sixth graders, and then any other kids that happen to switch from one school district to another. They would be reported as well, so that we can assure that kids are maintaining their immunizations.
And I think this is a good time to mention maybe something about Michigan's vaccine registry, the record keeping, because obviously that's a very important piece of this. And Michigan has a pretty advanced way of tracking and keeping track of who's had vaccinations.
Yeah, it's actually been kind of a stellar vaccine monitoring system that the whole country is looking towards, and Bob has done a fantastic job with his staff on running this program, which is not only keeping track of the vaccines and shoulder vaccines, but we're now increasing it to look at adult vaccinations to keep that up, and especially as chronic diseases increase, and there's certain vaccinations that many people with certain chronic diseases should have. We can keep better track of that. It has also, we put our lead screening into that to keep track on that, so it's been very well used. In fact, one area that we hear a lot of comments from the provider community on how helpful that has been on keeping up and being able to see when people have gotten the immunizations, what immunization they've actually received, depending if it's from different companies and so forth and so on. And so it's been a huge success, and I think Bob could tell you a little bit more about the logistics of how this has progressed very quickly over the last few years since it's come into being.
If I'm a physician in Kalamazoo and I have, say, a family move into town, and maybe they're from Grand Rapids or Saginaw, and they come in and it's August, they're getting ready to start their kids up in school, and maybe they don't have medical records, they think they've had some vaccines, they're not sure. This is a way I can check to see, in fact, what's been administered.
It's one of the beauties of the system is anybody who is in the system is accessible by any other physician office across the state, only if they can uniquely identify that child, though. They don't just get access to everybody in there. If they can uniquely identify a child, then they get access to that child's immunization records. And prior to the registry, we found that a lot of parents just lost immunization records, and so we had to restart immunization series and things like that. It actually cost a lot of money to do that. We're saving money now in physician offices by having a record available to the physician or even to the school to be able to make the determination on what shots are needed.
Vaccination really has kind of a Michigan connection in its history, because I remember it wasn't too long ago we noted it would have been the 50th anniversary of the polio vaccine trials, right? Does that
Yep, that's correct.
ring a bell?
Dr. Salk was involved with that out of the University of Michigan, and then he went to the University of Cincinnati and was very involved with the first vaccine that was licensed in 1955. It's actually also the same time that federal funding, and then along with state and local, started for an immunization program within the United States that has brought forth all this coordination for vaccinations. But
there's another real strong tie to Michigan and vaccines. I'm not sure if you're aware that until about 10 years ago, Michigan produced, one of two states in the country that produced vaccines for Michigan residents, and produced the DTP vaccine, the rabies vaccine, the tetanus diphtheria adult, and so several vaccines were actually manufactured here within the state.